Hello, I'm Chris Gibbons. I'm Public Health Principal at Sheffield City Council in the Public Health team, and this is the coronavirus update for the 31st of August 2021. So in terms of epidemiology, our latest 7-day rate continues to be at around 300 to 330 per 100,000 and is oscillating around about that mark. Recent estimates by the ONS indicate that the true rate may be much higher than that, so it remains important that people get a PCR test if they have symptoms. This is a high rate for August. This time last year, the rate was 20 to 40 per 100,000. Overall, it's a mixed picture, with case rates in the under 18s beginning to head back up after a period of decline, with rates in adults and older adults levelling off at a high rate, and we are seeing the impact of some local music festivals on our case rates as well. There is concern that it doesn't take too much to see a rapid rise in case rates from this point when we're at this level, and in September we have schools and universities opening back up. Hospital admissions have remained steady at around 50% of the previous January peak, but we are seeing a steady rise in the number of people requiring oxygen support. So from today, everybody over the age of 18 will be offered the opportunity to opt in to antibody testing when registering for a PCR test. If you do opt in, randomly selected individuals who subsequently test positive will be posted an antibody test to use at home and return for analysis. The test kits will contain finger prick tests along with full instructions on how to complete the antibody tests. Following the return and analysis of your antibody kit, you will receive a test result back by text or email 2 to 4 days after posting each test. Test results are for information only, and you do not need to do anything with the test results. The results will automatically be recorded on the participants' patient records, and participants will be informed of how their data will be handled before opting into taking an antibody test. Antibody testing is a key part of the UK government's response to the pandemic and helps us understand immune and response and vaccine effectiveness to COVID. So in terms of vaccinations, around 72% of over 16s have received 2 doses of vaccination. If you've had your jabs, thank you. It remains one of the most important ways that you can protect yourselves and others from severe illness. The rate at which people are getting vaccinated has slowed, so it's important that people continue to please come forward for both doses of vaccine. There are lots of options to get vaccinated in Sheffield, with walk-ins and pop-ups across the city. You can drop in without an appointment 7 days a week from 7:40 a.m. to 6:30 p.m. You can walk in with no appointment at the Sheffield NHS Vaccination Centre on Longley Lane between the hours of 8 a.m. to 6:30 Monday to Sunday. No ID will be required to have the vaccine, and there is no need to be registered with a GP. Now most of the children are back to school and things are a little less hectic, it's the perfect opportunity to make an appointment for your first or second jab, or pop in to one of the drop-ins. Please remember that you're not fully protected until you've had 2 doses, so make sure you get an appointment today or pop over to one of our walk-in clinics. We do have guidance for businesses, workplaces and other settings about the importance of natural and mechanical ventilation. When we talk, raise our voices, cough, sneeze, sing, respiratory droplets leave our mouth and our nose. Small droplets can be suspended in the air and build up over time, and the longer you stay indoors, the more people who are in the room, the more the droplets there will be in the air. Spending a long time indoors with other people increases your risk of being infected in this way. Fresh air, through natural or mechanical ventilation, can swap the stale air, which is full of droplets, with clean air, which is safer to breathe. The aforementioned guides provide recommendations for both mechanical and natural ventilation, and a link to this information will be available at the end of this video.